But making healthcare unaffordable is excluding people. When I hear about what other families are facing, whether it is things like medication or surgeries, things that they depend on to literally keep their children alive, that they would lose access to if this legislation passed, it's really devastating. No one should have to choose between paying rent and paying for insurance. It's just not right. Leo was born with cerebral palsy, and defining him by that and limiting his access to the healthcare that he needs because of the way that he was born is like the purest form of discrimination in my mind. It is basically saying that there's something wrong with the way that he was born or that he is flawed in some way. He's not. He's amazing. And you're not a baby anymore, that's true. And cerebral palsy is a part of who he is, and he shouldn't be penalized for that. People watching this, please protect people like Leo and I, and ask your senators to vote no on the Affordable Care Act repeal.
Ladies and gentlemen, please give a warm welcome to Ben Wickler.
Good evening, Pittsburgh. I'm Ben Wickler. I'm the Washington director of MoveOn.org. In less than 1 week, the United States Senate could pass one of the most deadly, most vicious, most greed-fueled pieces of legislation in American history. The thing standing between that hideous bill and the American people is the resistance movement. And that is why we picked this city, Pittsburgh, home of one of the most energizing, inspiring, legendary resistance movements in the country, to kick off the Don't Take Away Our Healthcare tour with MoveOn.org and Senator Bernie Sanders. This is Code Red, and we are here tonight to show the entire country the energy, the passion that it will take to stop this bill. Thank you, yes. Who here has or has a family member who has a pre-existing condition? Woo! Who here believes healthcare is a human right? Who here thinks we should be going forward to Medicare for all instead of backwards to the bad old days? Who here is ready to fight? What Pittsburgh has been doing since Trump's election has been extraordinary. People across the country are hearing about it. Has anyone here been to a Tuesdays with Toomey event? Welcome to Saturday with Sanders. We have an extraordinary night ahead of us. We are joined tonight by our co-hosts and co-sponsors of tonight's event. Let's give it up for One Pennsylvania, for Keystone Progress, and for Planned Parenthood Pennsylvania Advocates. First, let's be clear about what this bill is. This bill is first and foremost an assault on Medicaid. Who here is against assaults on Medicaid? This is what they don't want you to know. Donald Trump vowed, he promised over and over not to cut Medicaid. He said in the campaign, that's what made him different from other Republicans, that he wouldn't cut Medicaid. It was a lie. But the American people don't know it yet. Listen, we know that this bill is already hideously unpopular. It has 17% support. 17%. The number of people who want the House version of the bill to pass unchanged is 8%. For comparison, the fraction of Americans who believe that chocolate milk comes from brown cows is 7%. It's about the same, possibly the same people. But that's how unpopular this bill is before people know about the attack on Medicaid. 6 out of 10, more than 6 out of 10 Americans do not know that Trumpcare would gut Medicaid. There's a new poll today. More than 60% of the country does not yet know. We are going to tell them. Two-thirds of people in nursing homes get support from Medicaid. 1/3 of Medicaid funds go to people with disabilities. And more than 10 million people on Medicaid will lose their health coverage if this bill passes. So we are going to fight for Medicaid. The second thing this bill does is it takes the Affordable Care Act and it makes the care so unaffordable that people won't get it. It's not repeal and replace. It is just gut and leave to die. We don't yet know the number of people that the Congressional Budget Office says will lose their health insurance if the Senate version passes, but we know the House bill would kick 23 million people off of their coverage. Now in 2026, if all those 23 million people lose their coverage, that means 28,000 people die in that year alone. Shame, 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 shame. And why do they lose coverage? Because for all of the complaints from people like Senator Toomey about rising deductibles and rising premiums, and those are real problems, this bill would make them worse. For older Americans, their premiums could go up by more than 500%. It is shocking. It is ridiculous. So why would you attack Medicaid? Why would you make healthcare unaffordable? That's the third thing to know about this bill. The whole thing is a ruse for a tax cut for the very wealthiest Americans. Ooh. People who never have to worry about this stuff. That's exactly right. So it guts Medicaid, it makes healthcare unaffordable, and then it hands hundreds of billions of dollars to the richest Americans. If you're one of the 400 wealthiest Americans, first of all, congratulations. Secondly, you would get a $7 million a year tax break from Trumpcare. You don't need it. You're already a billionaire. So we are going to fight this thing. We're going to blow up their phones in the Senate. We're going to visit their offices. We are not going to give up. And if they pass this thing, they're going to hear about it in 2018. Vote them out.
Vote them out. Vote them out. Vote them out. Vote them out. Vote them out.
So one thing I'd like to ask folks to do, and then I'm going to introduce our first three speakers. If you have a phone, I'd like you to take that phone and take it out of your pocket and hold it up. I see some phones. I see some more phones. All right. If you text if you text the word protect to the number 787-853, you're going to get alerts about actions to fight for healthcare this week and until we win this fight. That number again is 787-853. What's the number? 787-853. And you text the word protect. What's the word? Protect. All right, I'm giving you 3 seconds to send that text message. Did anyone? It didn't work? You know what we're going to do? We're going to figure out how to make it work. And I will be back to tell you more about how to do this, because we're going to fight until we win this battle. When Medicaid is under attack, what do? Stand up, fight back. When Medicaid is under attack, what do? Stand up, fight back. When the ACA is under attack, what do? Stand up, fight back. When healthcare justice is under attack, what do? Stand up, fight back. All right, give yourselves a round of applause, folks. Thank you for being here. I'd like to welcome our first 3 speakers to the stage. Georgianne Kohler is a retired healthcare worker. She fought to get the ACA passed into law. Now she is fighting to make sure that it does not go away. Dan Dubé is the executive director of Keystone Progress, and he's the father of 2 sons who will be affected very directly and very personally if this bill passes. And Danae Johnson is studying social work at the University of Pittsburgh, and she joins us with Planned Parenthood Pennsylvania Advocates to talk about what's at stake in this battle. Let's give it up for our speakers. Georgette, thank you.
Hello, my name is Georgianne Kohler, and I'm here to tell you about Billy, my brother. Billy died in March of 2009, 1 year before the Affordable Care Act was signed into law. Why? Because he had a sudden death heart arrhythmia, and when the battery for his AICD, an internal defibrillator, was running low, he couldn't afford to have it replaced, and his work didn't offer any health insurance. Billy had a great job as an electronics tech. He loved that job. But when he got laid off in 2003, he took a job delivering pizzas just to make ends meet. His job didn't offer any benefits. And despite a meager pay, he made too much to qualify for Medicaid. They said he would probably qualify if he quit his job. But Billy wanted to work. Billy was well aware of his heart problems, but after he lost his job, no insurer would cover him based on his pre-existing condition, except for one, which refused to cover anything related to his DeSauds-DuPont heart arrhythmia. His salary would not cover the tens of thousands of dollars that would cost to replace the defibrillator. The doctor told him he would not replace it unless Billy came up with the money. On March 7, 2009, Billy finished his shift at the pizza shop. He drove 2 blocks. He came to a stop sign. He put his car in park, and he slumped over his steering wheel. He was gone. His heart had stopped. The battery in his defibrillator was so depleted it couldn't restart his heart, and he died. I was devastated because I had told Billy that his defibrillator was a life-saving piece of equipment, and it would be unethical for any doctor not to replace it. They would just have to. I just knew it. Well, I was dead wrong, and Billy was dead. Since my brother's death, I worked tirelessly to fight for health reform. I knocked on doors and even asked people I would meet on the street to share their health care story with me, I bet a lot of you are glad you didn't know me. I would write the stories on paper on a spiral notebook so I could bring them with me to Washington to share them with legislators. When we finally did go to Washington, we had over 1,000 stories to share. I thought I won the fight when the Affordable Care Act was finally passed into law. I must be wrong because I'm standing here again today. Now Senate leaders want to take the progress away that we accomplished. They have introduced a bill that is cruel as well as heartless. It takes away protections for people with pre-existing conditions, and it makes devastating cuts to Medicaid. I wonder, did they not know anybody, or did they not love anybody who had to die because they couldn't get the health care they needed to live? I guess not. We can't let these men turn back the clock. We just can't. I will continue to fight in my brother's memory for everyone out there who will lose their access to the care they need to live a full life. We mustn't let this bill pass. Our very lives are at stake, as well as our nation's moral compass. Thank you very much.
Good evening, everyone. My name is Daniel Dubé, and I'm here tonight because, like many of you, my family is suffering. My 2-year-old and 3-year-old sons have been diagnosed with autism spectrum disorder, and because of that, my family faces many unknowns, and now, on top of the unknowns we have personally, we face the unknowns about the future of healthcare in this country. I love my sons for the amazing, creative, hilarious, beautiful creatures that they are, and I will do everything that I can to give them what they need for the brightest possible future. And all the best research shows they need 40 hours of intensive applied behavioral therapy. The minimum recommendation is 25 hours. And with ASD, the earlier the treatment is received, the better, so the clock is ticking. Because he's 3 years old, my older son, Dashiell, is beginning to get services through PA's Department of Education and through Medicaid. And through this program, he is eligible for just 2 hours of therapy a week. That's as is. That's the status quo. The people he works with are underappreciated, underpaid, and overworked. And they are the very people who give him the best chance of the best possible outcomes, and they deserve our faith and trust as well. Now, under the AHCA, even this meager program comes under threat. Because this bill cuts taxes for millionaires and billionaires and puts them ahead of people's health, my sons' futures are under attack. Senator Toomey, my sons are not, as you say, burned out buildings. They are not, that's right. They are not profit loss data points on some spreadsheet. They are beautiful human beings who have unlimited potential, like all children. Now, some will argue that my children only deserve what I personally can provide for them on my own. And so we're clear what they need and what I would need to provide are 2 full-time behavioral therapists. And I don't have an extra $100,000 a year lying around, and neither do the 1 in 68 parents who are affected by this disorder. So, Senator Toomey, while my family is suffering, I am truly optimistic because the struggle has never been more clear. This is no longer left versus right, Republican versus Democrat. It's bottom versus top. And there are more of us than there are of you. At the top, there are millionaires and billionaires who care more about shreds of money than my children, and the bottom is me, my boys, my wife, my family, and 300 million friends. Senator Toomey, we do not live in a time of scarcity. We live in a time of scarcity for the many and unprecedented wealth for the very few. And through the work of organizations represented here tonight, like Keystone Progress, One Pennsylvania, MoveOn.org, we are not just getting mad, we are getting clear. Clear that we have the power to make this country better than it's ever been for all of our children, and we will keep building power until we get it. I ask you, Senator Toomey, what is the point of civilization except to take care of each other, to provide the members of the Club for Growth with a few more shreds of wealth? Senator Toomey might think so. Representative Mike Kelly might think so. But do we think so? No! We know the sickness in our society is a government that only works for the few, but we are the many, we have the power, and we are the cure. Thank you very much.
Hello, my name is Danae Johnson. Thank you for being here with me today. I'm one of over 2.5 million Americans that rely on Planned Parenthood. When I was 15 years old, I found out that I was pregnant at Planned Parenthood. The tests were free and confidential, which was perfect for me and my family because we relied on Medicaid. When the test came back positive, the people at Planned Parenthood treated me with care and respect. Where my family had tried to force me to get an abortion, my advocate at Planned Parenthood treated me like the woman that I was. Capable of making the tough decisions for myself and what would be a baby boy. In the beginning, I told my advocate I wasn't quite sure what I was going to do. My mom had kicked me out due to my decision to carry to term, and my baby's father was no longer involved. My advocate at Planned Parenthood never pressured me or rushed me into making a decision, and over the first couple weeks, she taught me about the processes that were taking place inside my body and how to maintain good health. Through these weekly sessions, I was able to earn coupons, which I could then redeem for maternity clothing and other items that I needed, but I couldn't afford. We talked about different options over the course of those weeks, and when I came to the decision that I wanted to make an adoption plan, my advocate helped me to find the perfect agency. Throughout the entire adoption process, my advocate, from the first phone call until after the birth, was there for me with emotional support and education. Because of Planned Parenthood, I was able to successfully make an adoption plan at 15 years old. My son is now 5 years old, and this year in the fall, he goes to kindergarten. I am 21 years old, and in the fall, I'll be a senior in college. This was all made possible, at least in part, by Planned Parenthood. There are millions of stories like mine made possible by Planned Parenthood, and I am here today to put a face to just one of those stories. It is our job to keep up the fight to ensure everyone continues to have the access that I received at Planned Parenthood, and I am asking you to never give up the fight beside me.
Let's hear it for the speakers, you guys. When Planned Parenthood is under attack, what do? Stand up, fight back. All right, get out your cell phones, folks. We're gonna do it right this time. Now let's remember, when the House tried to vote this horrible bill through, They failed the first time, but unfortunately they persisted and they passed it. So when we now take out our phones and type in the contact 787-753 and then text PROTECT to that number, we will succeed. 787-753. What's the number? 787-753. And the word is PROTECT. It worked! Yes! That's what I'm talking about. All right. Let's try a slightly more complicated chant. It goes like this. Senator Toomey, here's what you don't get. If you pass this bill, we'll never forget. Does that work? Senator Toomey, here's what you don't get. If you pass this bill, we'll never forget. Senator Toomey, here's what you don't get. If you pass this bill, we'll never forget. All right, here's a simpler one. Lives are on the line. 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 All right. This week, keep your phone by you. I'm serious. There are going to be twists and turns. Right now, officially, Republicans don't have the votes. But you know why? It's because the far-right senators are saying it's not mean enough. We've seen this show before. This happened in the House. They want to make it more cruel. They want bigger tax cuts for the rich faster. They want to kick more people off their health insurance. They want to make health insurance worse for those who have it. And what it looks like is that at the last second, Mitch McConnell the turtle, 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 turtle. Mitch McConnell might replace the already terrible bill with something even worse at the last second. There might be a series of amendments that bring the far-right senators on board as we go into the home stretch. This is one of the smartest, most clever, most cynical, and most devious legislative tacticians in American history, and he is coming for your health care. And we are coming for him. We are coming peacefully and through the legislative process and as citizens for him. And the way we are going to beat this is by making such a noise in Pittsburgh, such a noise in Pennsylvania, such a noise in Maine, such a noise in Alaska, such a noise in West Virginia, such a noise in Ohio, such a noise in Nevada, such a noise in Arizona, such a noise in Tennessee, that all the senators that think maybe they shouldn't vote for this because it's too mean, not mean enough, they will know that it is the end of their political careers if they pass this bill. And then we're going to fight for something better, which we know we need: Medicare for all. This is the first night of this tour. Tomorrow, we're going to Columbus, Ohio, and then we're going to Charleston, West Virginia. Your voices will echo across this country. And tonight, we're joined by people watching on the internet. If you have a sign or a hand, let's wave to everybody who's watching right now. You are not alone. We are a movement, and we are fighting. And now let's greet our next three speakers, the third of whom will introduce our guest of honor tonight. I'd like to introduce Brenda Dare with ADAPT, where is he? There you are. Just came on stage with me. with ADAPT. I don't know if folks saw the video of some of Brenda's friends from ADAPT going to Mitch McConnell's office and having an incredible protest. Yes. Then we'll be joined by Leanne Howell, who is a healthcare worker with SEIU, who represents one of the more than 750,000 people who not only have their healthcare threatened, but who could lose their jobs if this bill passes. This bill is a job killer as well as a people killer in general. And then Angel Gober from Action United is going to introduce Senator Sanders. So I'd like to welcome all three of our next speakers. Brenda, thank you.
Hello, everyone. I'm here to tell you a story that starts out as my story, but it ends as all of our stories. I was born in 1972 to a lower middle class family. I spent my first 36 days in the NICU, and I wasn't expected to make it through my first 36 hours. If lifetime caps on health insurance had been a thing at that time, I would never have seen sunshine before I became uninsurable. I will not see that happen to children born like me in my lifetime. Because of the thinking that existed when I was born and during my young years, my parents were advised that the best place for me was in an institution. And though they resisted for the first few years, at the age of 3.5, my parents reluctantly left me at the Home for Crippled Children in Pittsburgh so that I could get better, so that I could be more normal. What's normal? Right. Institutional living rips families apart. I spent 7 years in those walls, and I was fortunate. I got good care from good-hearted people that helped me see there was a lot in my future if I was willing to fight for it. And believe me, nobody knows how to fight and do more with less than people with disabilities. It was in those walls that I learned that I was part of a community that is strong and proud and ready to set precedent for this nation. We are the tip of our spear, and we sharpen ourselves every day for the fight. And believe me, it is just beginning. As I grew up, I knew that I wanted to work to help other people with disabilities have good chances and good futures. I was lucky enough to land at a Center for Independent Living, and if you don't know what that is, see me and find out. We work on a daily basis to keep people informed and empowered, to give people the skills they need to fight for their health care and their human rights. We know that people with disabilities can serve as a resource. Senator Toomey and all of your friends out there who think that this tax cut bill disguised as health care is the way to go, we can teach you better. You want to compare me and my friends to burned out buildings and call us useless? Well, let me carry my matches. Because I'll show you how a fire burns. I am so proud to wear the mantle of Southwestern PA ADAPT. I wasn't part of what happened outside Mitch McConnell's office, but I sure wish I was, and I support everybody who was there. We will not rest until we see our government get to work on a healthcare system that meets our needs and is fair to everyone. And though these rallies are wonderful things and it's great to share energy with all of you, it can't stop here. We have to do more if we want to be more. Work with us. Tell your leaders, this is not acceptable. This is not our America. And I see a lot of people who say that 45 is not their president. He is my president, and that means I'm his boss.
Hello, my name is Leanne Howe, and I've worked as a nurse for 22 years. Thank you. As a nurse, I can tell you that this Senate health care bill, with its savage cuts to Medicaid and rollback of ACA protections, would dramatically affect the quality of care that I am able to give my patients. It will affect care in nursing homes and home care settings across the country. Funding cuts will lead to staffing cuts. This leads to grandma and grandpa suffering even further. Waiting longer for care, basic care, due to less staff. We already face a care crisis in America when it comes to our elderly and our most vulnerable. We're already short-staffed in nursing homes and home care settings. Home care providers are underpaid and overworked. If this Senate bill is passed, the problem will only become worse. Healthcare providers like me will lose their jobs. It's not only my job that's in jeopardy. My health and the health of my family members is in jeopardy as well. My 9-year-old son is autistic, and his therapy is funded through Medicaid. My grandson needs a hearing aid, and without Medicaid, he wouldn't be able to receive it. I have a 23-year-old son who had a traumatic brain injury, and he needs 24-hour care. It's funded through healthcare, through my healthcare and Medicaid. If these devastating cuts to Medicaid are passed, his home care will be reduced or cut altogether. I have my own health problems, but thanks to my union, I have quality insurance for my employer. We shouldn't repeal Affordable Care Act, but fix it. Fix it and make sure we all have access to quality, affordable health care. Don't give tax cuts to the rich who can afford to pay taxes and buy expensive health care. By gutting Medicaid and repealing the ACA, these men are saying that my life and the lives of my family members aren't as valuable as tax cuts to the wealthy, rich and powerful. These men took an oath to serve all of their constituents. not just the rich and powerful. Stand up and fight back. Let your politicians hear your voice and tell them to vote your way. Fight now and fight at the polls come election time. Stand up and fight back. Thank you.
Ladies and gentlemen, please give a warm round of applause for the lead organizer of One Pennsylvania, Angel Gober.
I didn't realize how many people was out here. All right. All right. Hello, everybody. My name is Angel Gober, and I'm actually with One Pennsylvania. One PA is a statewide organization fighting for economic and racial justice for all Pennsylvanians. Yeah. And one of the ways that we do that is we follow the money, confront the power, and demand the change. So look, we all know why we're here today, right? We're here to talk about this fake healthcare bill. This is a blatant lie about giving people health insurance in this country. This bill isn't that complicated. This is what happens when the rich and powerful are given the keys to the castle. They steal from the poor and they give to the rich. Yeah. Boo. Shame. This bill forces regular folks to pay more for worse insurance or lose their health care entirely. It's a way to hand tax cuts to billionaires and devastate children with disabilities, seniors, sick people, and even pregnant women. Exactly. So this, from the men who call themselves pro-lifers. Republicans don't just want to roll health care back to 2010. They want to take it all the way back to 1965 when Medicaid was first enacted. Destroying Medicaid is not pro-life at all. It covers 40% of adults at or under the poverty line, 76% of children at or under the poverty line, and also Medicaid covers 60% of children with disabilities. I could go on and on about the harm that this bill will cause, especially here in Pittsburgh, but it is not pro-family to defund Planned Parenthood, block families from Medicaid, or stop patients from accessing care. Yeah, that's right. All right, Glenn. It's also not pro-life to take away the only clinical care so many of our sisters, our mothers, our aunties will ever get in a year. I know what it means to need health care. I had to rely on Medicaid. I was a young single mom, and I couldn't have made it without the help of Medicaid and the services that Obamacare guarantees now. Yeah. Now I have employer coverage, thank God for that, but you and I live every day alongside folks who heavily depend and lives depend on the Affordable Care Act. Raise your hand if you or somebody you know relies on the Affordable Care Act today. That's right. So in Pennsylvania alone, 1.2 million people could actually lose their health care coverage, 700,000 because of changes to Medicaid. Our state would lose $4.8 billion every year if this Senate bill passes. And guess whose bright idea that was? Take a guess. Pat Toomey. What a good guy. Shame. He was actually one of the 13 white men who met in secret to propose this outrageous bill. Yeah. Senator Toomey, who represents a state that already lacks the resources to properly fund our education system, provide quality community services, a robust transit system, and a safe and healthy environment. If this bill passes, those who are most in need of medical care, like children, seniors, and people with disabilities, in which Medicaid was actually designed to protect, will die prematurely and or suffer unnecessarily from illness. Why is that? Why is that? Because of greed. Because of money and greed. Senator Toomey and his Republican friends wrote a bill that's not about health care. This is not a health care bill. This is a health care bill. It to give tax cuts to the rich, I'm sorry. It's $600 billion in giveaways for the richest Americans and the largest corporations. That's right. We can no longer allow them to get away with blatantly destroying people's lives. Not today, not in our country, and not tomorrow. That's right. So we cannot go backwards. We cannot backpedal. We are not about to let you steal from us to give more money to rich folks. Many of us right here in this room fought like hell for the Affordable Care Act. Not because it was popular, because it was the right thing to do, and Obamacare would save millions of lives. So I must say, we must continue to resist against Trump and his harmful and outrageous ideas and policies. We will continue to organize and call out bad politicians like Senator Toomey. We can no longer be a country where we put profits and money over helping and supporting our most vulnerable Americans. That's right. So I was actually a part of the 22 people that got arrested in front of the White House a few months ago. And we were demanding to end this immoral, harmful Trumpcare bill. And guess what? I'll do it again, and I'll do it again. And I'll keep doing it until we let these heartless politicians know that this is not what we want for people in this country. And so today, we are thrilled to be joined in this fight by a politician that has some real heart. And I was proud to, yeah, Bernie. And I was proud to serve as a delegate for Bernie at the DNC this past primary. And I don't care what anybody says. Had we won, we wouldn't be having this fight today. So let's turn it up for our Senator Bernie Sanders.
Thank you. Let me begin by thanking you all. This is a large turnout here, so I appreciate you all being here. And I want to thank you not just for being here, but for standing up for justice, for standing up for dignity, and for demanding a government that represents all of us and not just the 1%. And let me thank MoveOn.org, Keystone Progress, and 1PA for organizing this event. And let me also thank those folks who have spoken already, especially those who have talked about what this disastrous health care bill will mean to their own families. It's not easy getting up and talking about your own family and some of the most personal things that you are dealing with. But when you hear people talking about what this bill does to them and their families, they're not just talking about themselves, they are talking about millions of people, and I thank them for being here. Let me be as clear as I can be. This so-called health care bill passed in the House last month is the most anti-working class piece of legislation passed by the House of Representatives in the modern history of this country. And the Senate bill, in some respects, is even worse. So what we are here tonight to say, as clearly as we can, is that we will not allow 23 million Americans to be thrown off of the health insurance they currently have in order to give over $500 billion in tax breaks to the top 2%, to the insurance companies, to the drug companies, and to other multinational corporations. Plain and simple, this so-called health care bill is nothing more than a massive transfer of wealth from working families to the very, very rich. While there are massive cuts to Medicaid, while seniors will pay far more for their health care premiums, while Planned Parenthood would be defunded, the 400 highest income taxpayers in America, most of them billionaires, will get about $33 billion in tax cuts. Brothers and sisters, at a time when the middle class of our country continues to shrink, when families in Pennsylvania, Vermont, and all over this country are struggling to make ends meet, to put food on the table, to pay the rent, to save a few bucks for retirement, we will not be part of a process which takes from working families, takes from the sick, takes from the children, takes from the elderly, takes from the poor in order to give huge tax breaks to people who don't need it. I say to my colleague, Pat Toomey, this legislation is not what this country is supposed to be about. In America, we're not supposed to take from the children, the elderly, and the sick to give tax breaks to billionaires. This is a barbaric and immoral piece of legislation. Senator Toomey, please vote no when this bill comes before us in the Senate. Senator Toomey, your vote could make all of the difference in terms of whether this disastrous legislation passes or fails. Last month, as you know, by a 2-vote margin, the House passed their disastrous bill. And the Senate bill and the Senate bill, which is very similar, will likely come up for a vote within the next few days. And I want to tell you very briefly what the Republican House bill does. At a time when 28 million Americans today have no health insurance, and millions more, including many of you, are underinsured with high deductibles and high co-payments, this bill would throw 23 million Americans off of health insurance they currently have, including almost 800,000 right here in Pennsylvania. This bill would bring the number of uninsured in our country to over 50 million people. This is almost beyond belief. This is unconscionable. Everyone knows that the Affordable Care Act is far from perfect. Our job now is to improve it, not destroy it. Further, instead of throwing 23 million Americans off of health care, we should move to join the rest of the industrialized world and I think there are not a lot of people who know this. We are the only major country on earth that does not guarantee health care to all people as a right. We should not be paying the highest cost per capita in the world for health care, because the function of health care should be to provide quality care to all people at the least possible cost, not to make billions in profits for the insurance companies. We, at a time when 1 out of 5 Americans under 64 cannot afford the prescription drugs their doctors prescribe, we should not be paying the highest prices in the world for the medicine that we need. What we should be doing is having the guts to take on the insurance companies and the drug companies and move toward a Medicare for all single-payer program. That is where we have got to go, and clearly the momentum from California to Maine is with us in that effort. I want all of you to think for a moment about the implications of this bill and what it means to those people who will lose their health insurance, the children who will lose the health insurance they currently have. Think about it for a moment. What does it mean? And I want you to put yourself into somebody else's mind and body for a moment. What does it mean if you today are suffering with cancer, undergoing radiation treatment, you're dealing with heart disease and you're worried about your future, you're dealing with asthma, you're dealing with diabetes? What do you think is going through people's minds today who are dealing with life-threatening diseases and understanding that if this terrible Republican bill goes through, they could lose their health insurance? They could lose the care that they are receiving today, which keeps them alive. What happens when you are sick and you have no health insurance. Well, I will tell you what happens. And the horrible and unspeakable truth is that if this legislation was to pass, and if millions of people, many of whom are terribly ill today, were to lose the health care that they have, there is no question but that many, many thousands of our fellow Americans will die unnecessarily.
Unacceptable. I will die.
Now, that is not Bernie Sanders talking. That's what the experts at the Harvard School of Public Health are telling us. They suggest, and nobody obviously knows exactly what will happen, but they suggest, based on their studies, that up to 28,000 Americans could die if this legislation is passed. In the wealthiest country in the history of the world, we must not allow that to happen. Let me tell you what happens when you cut Medicaid by over $22 billion here in Pennsylvania and well over $800 billion nationally through a 10-year period. What it means is that if you are a child, and I want you to imagine in your mind a child with a severe disability, that child will likely no longer be able to get the health care that he or she needs to adequately function. An estimated 11 million children, or 15% of all kids in the United States, have special health care needs. They may have conditions such as Down syndrome, cerebral palsy, muscular dystrophy, or autism. They may have mental health needs such as depression or anxiety or complications from a premature birth. Today, Medicaid and CHIP, Children's Health Insurance Program, cover over 5 million, or 44% of these kids, providing them with coverage so that many of them can live with dignity and with security. In addition to standard health care services, Medicaid helps these kids get special education in school, helps them get long-term care, personal assistance from nurses and attendants, and as somebody previously said, those nurses and attendants do a great job. They're underappreciated and overworked. Medicaid may also cover social workers to help parents of children with special health needs get through the bureaucratic red tape so that they can get the services their children need. Medicaid provides these kids with quality care. 92% of kids enrolled in Medicaid or CHIP have had a primary care visit in the past year, which is higher than families with private insurance. If Medicaid is cut, children with special health care needs could be left to fend for themselves. Nearly 75% of children with special health care needs live in low or middle income families. What happens to these children and their families if they lose Medicaid coverage? What kind of country are we if anyone can come before you and talk about cutting health care for children with disabilities in order to give tax breaks to the richest people on earth? But it is not just the children who will suffer if this bill is passed. It is also the elderly, the senior citizens of Pennsylvania, Vermont, all over this country. What every person in Pennsylvania should know, and I think a lot do not, is that Medicaid now pays for over 2/3 of all nursing home care. 2/3. What happens to the 50,000 seniors and persons with disabilities in Pennsylvania who have their nursing home coverage paid by Medicaid today? Who will pay for their care if Medicaid is slashed? How many seniors now in nursing homes will get thrown out on the streets or be forced to live in their children's basement? How many middle-class and working-class families will now have to choose between figuring out how they can pay for the needs of their parents or provide funding for their kids to go to college? Remember, Donald Trump told the American people that he was going to stand up for the working class of this country. Throwing elderly people out of nursing homes is not standing up for the working class of this country. Further, if you are a worker today in Pittsburgh and you're 63 years of age and you make $42,000 a year, your average health insurance premiums will go up from $4,000 a year now to almost $7,500 a year, almost double. There are millions of seniors in this country who have nothing or almost nothing saved away for retirement. How are they going to get by if they're asked to pay $3,000 or $4,000 a year more for the health care that they desperately need? This is what the AARP, the largest senior group in America, says, and I quote from the AARP, quote, "This new Senate bill was crafted in secrecy behind closed doors without a single hearing or open debate, and it shows. The Senate bill would hurt millions of Americans with higher costs and result in less coverage for them. AARP is adamantly opposed to the age tax, which would allow insurance companies to charge older Americans 5 times more for coverage than everyone else while reducing tax credits. As we did with all 435 members of the House, AARP will also hold all 100 senators accountable for their votes on this harmful health care bill. My friends, here in Pennsylvania and in my state of Vermont, we have many, many veterans, men and women who have put their lives on the line to defend our country. Veterans must be treated with respect. Thanks to Medicaid expansion, which you enjoy here in Pennsylvania, approximately 340,000 veterans gained coverage through Medicaid from 2013 to 2015. If this legislation is passed, almost 11,000 veterans in Pennsylvania will be kicked off of the health insurance they currently have. Brothers and sisters, all of you are aware of the terrible opioid and heroin epidemic which is sweeping this country. It is a tragedy in my state, and it is a growing problem all over America. Each and every day, more than 90 people die from an opioid overdose, nearly 4,000 people begin abusing prescription drug painkillers, and almost 600 start using heroin. Our job is to address the opioid and heroin crisis through comprehensive treatment, not by cutting billions from the treatment that currently exists. Brothers and sisters, my Republican colleagues talk a whole lot about choice. Maybe I'm talking about choice. They want you to have the freedom to choose whatever insurance company, doctor you want. Well, 2.5 million women in this country have chosen Planned Parenthood. What this legislation means in Pennsylvania is that 32 Planned Parenthood health centers could be forced to close down, leaving over 90,000 patients without the care they desperately need. Brothers and sisters, every day I receive letters from Vermonters or people all over the country writing to me and telling me what this legislation will do. Let me just read a few of the letters. This is one from a mother. She wrote, quote, "My adult son has Down syndrome. He can barely get by with what few Medicaid services are available now. Please don't punish my son for needing these services," end quote. Here's from a father who writes, and I quote, "Trumpcare will allow insurance companies to deny health insurance to people with pre-existing conditions. In my family, this could disqualify my son, born with a defective heart valve, who must have costly open heart transplant surgery to get a new valve every 10 to 14 years. Another letter. "I am 38. I am well educated and had a great job, but I developed chronic migraine. I am so disabled I can no longer work. I just qualified for Medicaid. It will be my lifeline as I fight daily pain and other debilitating symptoms. If this bill passes, I fear that it will become a choice between draining my family's financial resources, even facing bankruptcy, so that I can continue to access the limited medical treatments I have that help my condition, or lose insurance altogether. I do not want to let my family go bankrupt. This law is not health care. If it passes, people will suffer and die. I can personally attest to that." This legislation is opposed not only by the vast majority of the American people, and poll after poll makes that clear. It is also opposed by virtually every national organization involved in health care in one way or another. And if you think about it, it is almost beyond belief that the Republicans could continue to go forward when you have groups like the AARP, the American Hospital Association, the American Medical Association, the American Cancer Society, the American Heart Association, the American Academy of Family Physicians, et cetera, groups who are on the ground, people who every day treat millions of Americans. They are standing up and saying, what a disaster this bill will be. Everybody in this room understands what is going on in our country today. You know that over the last 40 years, the great middle class of our nation has been in decline, and that today we have more income and wealth inequality than any other major country on earth. Today in America, unbelievably, the top 1/10 of 1% now owns almost as much wealth as the bottom 90%, and the top 1% earns as much income as the bottom, earns 52% of all income in this country. When workers in Pennsylvania are working 50, 60, 70 hours a week, when they are working 2 or 3 jobs just to survive, you don't take away their health care benefits to make the very, very rich even richer. What we are talking about today is not just health care. In fact, it goes well beyond this disastrous piece of legislation. Really, what we are talking about is what America is supposed to be. We are talking about a very profound moral issue. A great nation is not judged by the number of millionaires and billionaires it has or by the tax breaks they get. A great nation is judged by its compassion and by how well it treats the most vulnerable people in this country. And the most vulnerable people in our country are, by definition, the children, the sick, the elderly, the poor, the disabled. Those are the most vulnerable people. It is a moral outrage that this nation will never live down if we take away health care from the most vulnerable to give tax breaks to the very rich. This bill is a moral outrage. It must be defeated, and together we will do just that. Thank you.